Good afternoon. My name is Grace Whitney. I speak with you today as a developmental psychologist with over 40 years of experience in the field of early childhood. Currently, I have the privilege of working with the Federal Head Start program and serving as the Head Start State Collaboration Office Director in Connecticut. Fourth speaker from Connecticut. We must have stuffed the ballot box. My experiences over the years have formed and solidified my perspective regarding how children can be supported to move more seamlessly through a birth to 8 continuum. I will address what I believe to be 3 key elements that must be considered in the discussion today. And reflecting back on the panel early this morning, the comments that I'm going to make, I think, really do connect with all of the different roles in the early childhood field at many levels, and may introduce some of the cross-disciplinary, higher ed, and maybe interprofessional things that were suggested in the first panel. First, and from a true Head Start perspective, families must be supported and successfully engaged in any and all early childhood endeavors. Families are the consistent thread throughout a child's life. When families are strong, they can create and sustain a secure environment for growth. They are informed of what resources to access and what to expect from those resources, and they are their child's best and most enduring advocate to ensure continuity across components of any birth to 8 continuum. Those in the workforce must be competent in connecting with families in the broadest sense, understanding what resources and supports families need, and respecting them as the lead partner for children's lifelong health, wellness, and learning. Second, engaging and supporting families must begin early. The emerging infant mental health field aims to strengthen attachment and healthy relationships, since relationships are the foundation for healthy development and learning. Embedding the infant mental health competencies into professional development and infant mental health resources into a service continuum will enhance early social emotional development and promote healthy family relationships. Additionally, an essential component of competence in infant mental health is the capacity for reflection upon one's own role in creating authentic relationships with children, families, and others. It is within the context of healthy relationships that optimal learning happens for us all. Third and finally, any continuum must be responsive to the wide range of diversity, be it language, race, ethnicity, ability, economics, health, illness, opportunity, fortune, challenge, or trauma, and to the most needy children, families, and communities. In the U.S., one has a higher likelihood of being homeless at the age of 1 than at any other age. In a population study in Philadelphia, homelessness during infancy was predictive of child welfare and involvement in foster care in early childhood, and then failure upon entering school. Any birth to 8 continuum that systematically or subtly creates barriers to access and continuous participation for children who experience homelessness, or those receiving child welfare services, or any child who needs individualized accommodations is seriously flawed. Raising the bar by enhancing the early childhood system only for those who get there leaves those who need it most further behind. Those who would otherwise be disenfranchised must be included by design. Our workforce must embrace diversity and be competent in identifying, reaching out to, and engaging in sustaining relationships with families beset with diverse and often complicated needs. To summarize, any seamless pathway will operate through those successfully engaging families who begin early with the focus on attachment and healthy relationships, and who can be responsible to the vast diversity in our families, communities, and to the most needy in our nation. Thank you for the opportunity to share my thoughts with you today.